just going to let the soles of the feet walk together. Soles of the feet are touching. We're just going to let those knees come apart. Hands are going to come onto the belly. We're going to breathe into those hands continually as you inhale, belly rising. And as you exhale, belly falling. Once you find the rhythm of the breath, count. Belly rising, 1. Belly falling, 1. Belly rising, 2. Belly falling, 2. And so on and so forth. Continue with your counting. If at any point this feels intense for your hips, then you're just going to roll off to one side. You've got your bolster, or you've got a pillow or something like that, whatever you need. And you can always just take these bolsters or pillows or whatever the heck you got handy, and this is just like butter. Yeah, because it's a nice opening, but it's totally supported, so you're getting less stretch, but still the blood and oxygen is going to flow through that area, which is so nice, especially if you've been lying in bed for a long time. You just want them to be even, so if you're using 2 pillows, use 2 pillows, right? You're using 2 bolsters, use 2 bolsters, so that one hip's not get more opening than the other. So let's take 10 more breaths into our belly. Once those 10 breaths are complete, just letting your arms come out to the side, palms facing up, returning to your natural breath. Listening to your hips here, if it's getting to be too much of a hip stretch, just give yourself a break, walk those knees in, soles of the feet are on the floor. Just returning to the natural breath here. And if it's available, you can come back into the pose, soles of the feet coming together, knees apart, hands are going to come onto your rib cage. You're just going to breathe into those ribs with each inhalation, feel the ribs expanding, and with each exhale, feel the contraction. Once you find that rhythm, that flow, then begin to count. Ribs expanding, 1. Ribs contracting, 1. Ribs expanding, 2. Ribs contracting, 2. And so on and so forth. Continue to count. Let's count 3 more breaths into the ribs. And once those 3 breaths are complete, just letting your arms come out to the side, palms facing up, returning to your natural breath. We're just going to let those knees come together nice and slow. And then from there, we're just going to walk the feet apart. So knees stay touching, and we heel toe, our feet apart, and we keep those knees touching. One important ingredient is to pigeon toe, so the toes point in, so then the weight's out of the knees. You want to make sure the whole sole of the foot is on the floor of the bed, so that's comfortable. We're then going to inhale to reach the fingers up. Right hand comes to left shoulder, left hand comes to right shoulder. Reaching around with those shoulder blades, tucking your chin. And you're just going to breathe into the shoulders. So with each inhalation, you feel the shoulders expanding. And with each exhalation, you feel the shoulders contracting. Elbows rise on the inhale, and elbows fall on the exhale. It's just like you're giving yourself a hug. That right arm is over that left arm. You can hold on to your shoulders or even your shoulder blades if you can reach. Remember, you can take a break anytime you like. There should be no agitation with the breathing. So if you feel anything coming up, take a break. No physical agitation, no mental agitation. As we count 4 more rounds of breath. Once those 4 breaths are complete, nice inhale, reach those fingers up to the sky like you're going to touch it. This time left hand comes over right shoulder, right hand comes over left shoulder. We walk our fingers around until we hold our shoulders. Elbows gently squeeze and push into the chest. We tuck our chin so the neck is nice and long. And once again, we're going to breathe into those shoulders. As you inhale, shoulders expand, elbows lift. As you exhale, shoulders collapse, elbows sink. All breathing is in through the nose, out through the nose, and that'll cause maximum relaxation for the body, for the mind. But if there's any agitation at any point, you just stop. Return to your natural breath. Let's take 4 more deep breaths here into the shoulders, into the neck, into the throat. Once those 4 breaths are complete, let's inhale to reach those fingers up towards the sky. Exhale to bring those arms down halfway to a T. Palms are facing up. So basically the wrists are in line with the waist, but the arms are out to the side slightly. And then we're just going to take those knees apart. We're going to exhale to bring the knees down to one side. And then we're going to inhale the knees back up to center. We're going to exhale the knees down to the other side. Inhale back up to center. So nice gentle lower back release. We shouldn't feel this in the knees at all. If we feel this in the knees, then we just walk those feet in a little bit closer, and that'll take the stretch out of the knees as we go back and forth, side to side with our breath. The next time we come down to the right, let's stay to the right. If you want to take it a little bit deeper into the neck and the shoulders, you turn and look at the left hand, just gently. Listening to those knees. If those knees are sensitive, if they're together, there will be very little stretch in the knees. Whereas if they're apart, there will be more stretch in the knees. It's okay to get a little stretch there, but we don't want a lot. With each inhale, feel the body expanding. And with each exhale, feel the body contracting. Inhaling 1. Exhaling 1. Inhaling 2. Exhaling 2. Just a few more breaths on this side. And chin comes back up to center, pushing into your arms. Let's bring those legs up nice and slow. And let's slowly lower the legs to the other side. And again, if you want to take it into your neck, you can turn and look towards the right hand as you continue to focus on your breath. And counting your breaths. And you can always throw in that word relax. With the inhale, relax 1. With the exhale, relax 2. Relax 3. Relax 4. And so on and so forth. Continue to count each and every breath. Just a few more on this side. And then chin comes back up to center. Push into your arms to bring those legs back up to center. And again, return to your natural breath.